But another thing to take into consideration is that waste that is coming from people who are COVID-19 positive needs to be handled with care.
Yes.
And so, because of course waste, especially things like tissues, for example,
it's bio-waste.
contaminate.
Yes.
So those people who are taking care of COVID-19 positive people need to be taking special care when disposing of their waste. If the person who is sick is able to, I always suggest that they put their waste into 2 packets, and then that gets disposed of.
That's quite a handy tip, actually.
Yeah. Another thing to take into consideration is that when a person is positive with COVID-19, that they're obviously shedding the virus all the time, and at some point their linen is going to need to get changed.
Yeah.
And so very important to make sure that you are taking a special care when you are changing linen. My advice here is that if you are the patient and you're able to do so, you make sure that you are folding your linen from the 4 corners inward. And then if you are somebody who needs to be taking care of the person who's COVID-19 positive, if you are going into the room to remove the linen, you need to be doing the same. Make sure that you're not fluffing linen out.
No, you don't want to spread
You don't
that
want to be
virus.
spreading anything anywhere. And then of course you just bundle that laundry up and you try not to hold it up against yourself.
Yeah.
If possible, you can put it in a bag while you're transporting it to get washed. But that linen should be washed immediately.
Clean.
And then of course wash your hands.
Yeah. Okay, so just talking a little bit more about the laundry situation. Say you're the carer, you've gone into care for your partner, and now you've been holding the washing out. What should you do with those clothes you have?
So very important question, and I think this is something that we also need to be aware of, is that aside from the laundry that has the COVID-19 virus on it, of course if you come into contact with the person who is sick, you want to make sure that you are taking a shower after you've been in that room and that you are changing your clothes. You may even want to have designated clothes set aside for when you are going into that room. And just bearing in mind that this infection can actually sit on surfaces, and including, it's going to last on different surfaces for different periods of time, also depending on things like the environment, humidity, whether there's a breeze coming in or things like that. There's so many things to take into consideration, but the safest thing to do is after you've had contact with somebody with COVID-19 infection, firstly you should be limiting contact with them first and foremost. Secondly, you should be wearing a mask every time you come into contact with them. But then once you have left the space in which they're in, to make sure that you are changing your clothes, taking a shower, and make sure that you are maintaining good hand hygiene. There's one more thing I just want to mention about people who are positive in your household, is that COVID-19 can actually be shed in the stools. So every time people go to the restroom, there's a potential for them to be shedding virus via the stools as well. So a tip here is also to make sure when you are flushing the toilet that the lid is closed.
That's quite good.
So that you're not getting...
You're flushing the bathroom,
Correct.
so to speak.
Exactly.